My next two guests join me from Niagara Health to help explain more about the current research initiatives happening here in Niagara. I'd like to welcome Dr. Jennifer Tsang, Executive Director and Chief Scientist of the Niagara Health Knowledge Institute, and Elaina Orlando, Manager of Research. Dr. Tsang, I'll start with you. Research, that's a broad word. What's going on at Niagara Health?
Well, first of all, thank you for having us here. Health research is really an area of work that we do to try to understand how we better look after our patients. We adopt this ongoing learning philosophy, and that's how medical discoveries are made.
Dr. Elaina, tell me about the scope of the research.
We're fortunate that we have a very broad research program, and research happens in 8 different clinical areas at Niagara Health. So examples like cardiology, critical care, where Dr. Tsang works, infectious diseases, oncology. Our scope is very broad, and in 2024 we ran about 50 clinical trials and enrolled over 250 patients into those clinical trials.
250 people, that's quite a bit. Tell me about some eligibility requirements.
The eligibility criteria are based on the specific study. So while it's hard to generalize, it will differ by program area and the types of research that the investigators are participating in. So it could be that we're looking for patients who have just had a heart attack, or patients who have just had a stroke, or perhaps patients that are going into surgery for a knee replacement and we want to trial a new drug. So it's very dependent on the study, and so that means that any number of patients could be eligible.
Dr. Tsang, we were talking about this earlier, and a big thing is a lot of hospitals in Ontario don't run these departments. Why does Niagara Health?
Because of the importance of patient care that we see in Niagara Health, and also Niagara Health serves a very large region in the province, and we believe that one way of improving the care of our patient is to participate in clinical trials and also ask the types of research. And the reason why our program is unique is that we engage our patients upfront. When we develop our own research project that are led by Niagara Health, we often involve researchers and patient partners that is from our region. We co-develop and try to ask the questions that's relevant to our own populations.
Being an intensive care doctor, you've probably seen a lot. Do you really believe that these researches will help in keeping people out of intensive care?
Absolutely, because when we do research, and we not just do research in the laboratory or in the hospital, we actually apply the results of the research study by the bedside through a process called knowledge translation. And it's through COVID-19 was an example. We were able to adopt the use of corticosteroid really shortly after the beginning of the COVID-19 pandemic because of the studies that we took part in order to allow us to generate enough data to confirm that corticosteroids help with patients with COVID-19. That's a good example to use.
Dr. Orlando, May 1st is a special day in your calendar. Tell me why.
It is. May 1st is our NHKI Research Day, which is a celebration of the research activity that's happening in Niagara, both in our organization and in our community as well. And so it's a mini conference. We have a keynote speaker, we offer workshops, and we have individuals come and present their work at the event, which this year is held at Niagara College's Daniel J. Patterson campus in Niagara-on-the-Lake.
Now, you said keynote speaker. Can you share a little bit of who it might be?
Yeah, we're very fortunate this year to have Dr. Carrie Kaluski from the Institute for Better Health at Trillium Health Partners come and speak to us. And her area of work is really exciting for us to hear more about because it's about patient engagement and involvement in research. So there's a lot for us to learn from her.
Niagara College brought big Niagara-based post-secondary institutions, and what's nice is you are connected with them and you hire some students to do their research. Is that right? Tell me about that.
Yeah, we have a joint scholarship program between the Niagara Health Knowledge Institute and Brock University, Niagara College, and also University of Niagara Falls, Canada, and our partner in McMaster University. What we do is we share the funding. We select the brightest in the region, and we bring them to Niagara Health to work with us for 3 months over the summer holidays, and we work with them on projects so that they can get experiential learning opportunity on how to do research. The goal is that they learn about what we do at Niagara Health, and then when they finish the training, they will come back and to work in the region to serve our populations. And that's why we have this program in place.
A bit of a stretch on this next question, but I'm going to ask it anyways. With a new hospital being built in South Niagara Falls, how is that going to play with research? Is that going to be a big deal?
It is a big deal because we will then have another base of research in the south side as well. So right now, most research are based out of the St. Catherine site. Some's happening in Niagara Falls site, but when the new site opened, we will have a separate big branch in the south side, and that would also allow us to recruit patients to clinical trials, and we will have scientists based out of that hospital.
May 1st, Research Day at Niagara College. Ladies, thanks for joining us today.
Thank you for having us.